Sorry for the delay. Good afternoon, good morning, everyone. Uh, you will be hearing a presentation from Dr. Fatima Al-Hamlan, Dr. Mansour Al-Hajla, and Dr. Nada Al-Nashi. They will be speaking to us about women's health, safety, national strategies, and law. Dr. Fatima Al-Hamlan is a consultant and senior scientist at King Faisal Specialist Hospital and Research Center. She is the founder and the vice president of Rufaida's Women's Health Organization. Her work focuses on advancing patients' care through innovation, solutions, and supportive policies. Also, we have Dr. Mansour Al-Hajla. He is a distinguished expert in healthcare, health law, currently leads a law firm as a managing partner. His illustrious career includes roles such as a vice president of the HSTP for legislation and legal affairs and secretary general for various health ministerial commitments in Saudi Arabia. We apologize, Dr. Abdullah Asiri will not be with us for today. He had an emergency excuse. So we will have Dr. Nada. Dr. Nada, she will present on his behalf. So Dr. Nada is the director of Department of Prevention of the Assistant Deputy of Prevention Health, the Saudi Ministry of Health. She leads the task force of program of vaccinate girls against HPV, which is the first time in Saudi Arabia as a national school-based program through MOH with collaboration with the Ministry of Education for girls in the 7th grade, and the program started in March 2022. Please welcome with us Dr. Fatma. Dr. Fatma, the floor is yours.
Thank you, Hiba, and thank you for the organizing committee. Thank you for you all for joining us. Good morning, good afternoon, wherever you are. So today we will be talking about women's health safety in national strategies and law. My part, I will be focusing on the SDGs, which is the Sustainable Development Goals. We are here tonight or today, basically from different parts of the world, different continent, different regions, but we all have to be aligned with the patient safety, with the SDGs from different parts of the countries. We have a target that we have to reach by 2030. So today we will go through it and see how far we come when it comes to the SDGs. Also, I will be talking about my other hat, which is the advocacy, which is the NGOs, the non-government organizations, or the civil society organization, and its role in patient empowerment. And what does patient empowerment mean? So we will share with you some stories when it comes to patient empowerment toward patient safety. And also, what are the challenges that are facing the low and middle income countries and the lesson learned, plus the future direction. So to start off with the SDGs, so basically the United Nations have created 17 World Development Goals called the SDGs. If you look at these goals, it spans from the poverty, the hunger, the good health, the education, the gender equality, clean water and sanitation, etc. So there is 17. So that was created in 2015, and we have a target that we have to reach either by 2025 or either by 2030. So this is what we are going to visit today, and we will see the progress. So when it comes to patient safety, the first thing comes to mind is it's the SDG number 3, which is the good health and well-being. So basically, the patient safety is the central to the realization of the SDGs, in particular, number 3. What we want exactly with the patient safety, we would like to ensure healthy lives and promote well-being for all at all ages, and that will include the universal health coverage. However, if you look at the SDGs and the patient safety, you have to realize this. When it comes to the patient safety, it's not only related to SDG number 3, which is the good health and well-being, but also it intersects with so many of these SDGs. If you look at the education, if you look at the gender equality, if you look at the clean water and sanitation, it's all affected to our health. Also the infrastructure. You need an infrastructure for the healthcare system. If you look at the inequality, if you look at the peace, justice, strong institutions, it's all important for our health and our women's health rights. Also, partnership. Today we are here together in a partnership between WHO and the Saudi Patient Safety Center. So again, health, we need partners. And so if you look at the SDGs, really there is a direct relation and there is indirect relation, but it's all important. The United Nations have published the Sustainable Development Goals report that was published a few months ago. It's a very lengthy report, but I believe it's very important for each one of us to really reflect on these numbers and to assess our current status in each country. Are we doing our best? Are we achieving the goals that we are supposed to achieve? If you look at the summary of that report, it's not promising. So the president, he mentioned that halfway to the deadline for the 2030 agenda, the SDG progress is still half of the world behind. We are lagging behind. The progress on more than 50% targets of the SDGs is weak or insufficient. It includes poverty, hunger, and climate. And I believe with COVID, with the war that's taking place right now, with the climate, it's getting worse. So basically, we need to act now. Here is the summary of the health, the SDG number 3, the health. So I know it's busy infographic, but I will break it down for you. So we will start with the good news when it comes to the SDG number 3, the health. So the good news is, with the mortality of children under 5 years old, 146 countries out of 200, they are doing very well and they are on track. When it comes to the HIV treatment, so we are controlling the HIV new infections. We have noticed a decline about 52% since 2010, which is good. So we are doing very well when it comes to HIV. When it comes to the neglected tropical diseases, about 47 countries, they are starting to eliminate these NTDs. So this is good stride when it comes to healthcare. The bad news, about 4.9% of population worldwide, they are hitting into extreme poverty. Also, about 25 million children, they are missing vaccination, and it's getting worse. Malaria cases have surged worldwide. If you look at 2019, how many cases, and now we are up actually from 2021. So cases increasing, and malaria, we should control it by now. The worst thing also is a woman dies every 2 minutes due to complications in pregnancy and live birth. So these are things that we have to pay attention to, especially in low and middle income countries, because again, when we come to a mission worldwide, we are all aligned and we are all collaborating to make the optimum health for all. So to look at the global maternal mortality ratio, it's marginally declined. We didn't see much actually. If you look at the deaths in 2015, 227 deaths during live birth among women, and in 2020, 223. So only 4 numbers dropped, which is nothing. And what is the ultimate goal that is set by the SDG? It's 70. So still the number we have in 2020, it's tripled our target. We need to go down to 70 as a safe number for women losing life during live births. This is the under 5 years old death and neonatal mortality rate. If you look at the numbers, there is improvement. So basically, the dark green, it's the under 5 years mortality rate. And if you look at the light green, it's the neonatal. As you can see, there is a drop about 12% in the world and about 10% when it comes to the neonatal. And you can see in every continent what do they have. It's overall there is a drop. As you can see, it's different from nation to nation, but overall. Wa alaikum salam. So there is an improvement, and this is something positive, and we need to work harder on that. So when it comes to the SDG targets on HIV, malaria, tuberculosis, as I mentioned with the HIV, there is a great stride. If you look at sub-Saharan Africa, actually they are doing very well. So the light green is 2010. If you compare it to 2021, and as you can see, there is control of the HIV infection, the new cases worldwide. Also, there is a decrease, which is good. However, we are still behind our target. So during 2010, it was 1.4 million. And I believe in 2022, it was 600,000. However, the target is 370,000 by 2025, which is next year, basically. So we are still having at least 500,000 to control and to drop and stop infections because we have the treatment. Tuberculosis, the same thing. Now it's 2021, and you can see the cases are increasing. And TB, it has to be controlled since it's very infectious and it's spread crazy. So we have to really control it. Now it's back to increasing, and this is something needs to have attention to. So this is another crisis that we are seeing, which is the global shortage of health workers. Despite the high need of the healthcare workers, still we are seeing shortages worldwide. Look at sub-Saharan Africa. So the green is the nursing and midwifery, and the dark is the medical doctors. And see, it's small number of healthcare providers in these continents. Maybe the North America, they have lots of or high number of nursing and midwifery. Maybe Europe has more medical doctors in comparison to others, but as you can see, we are facing crisis when it comes to the healthcare providers, especially after COVID, where they started to resign and not continuing in this profession. Again, when we are thinking about healthcare, we always think about the rural area and the hard to reach area, because if you are an advocate, if you care about the healthcare system, you always have to look at everyone in your nation, not only in big cities. That will lead us to the civil society organizations and the role of the civil society organization. What I have presented before, usually this is the job of the government, where they handle how the healthcare system is run. When it comes to the civil society, they collaborate and they partner with the government, and they are the voice of the community. If you look at the World Bank definition of NGOs or non-government organizations, these are private organizations that pursue activities to relieve suffering, promote the interests of the poor, protect the environment, provide basic social services, and undertake community development. So I want you to go back and look at your nation and look at the NGOs. Are they empowered or not? Because the NGOs, they are the one who highlight the area that needs to be improved. So basically, the NGOs are typically value-based organizations. They look after their own people, and they always try to improve the health of all. So the role of NGOs, usually they play an instrumental role in global health. Remember, WHO is an NGO. It's worldwide NGOs, but again, in every country, you should have an NGOs. Luckily, in Saudi Arabia now, we have over 7,000 NGOs in different areas, not only in health, but really this is something promising that to take care of your community and also to look at the SDGs, because SDGs, it comes across everything, not only health. The NGOs master the community empowerment. They set the priority for each nation. I cannot tell you what is the priority in your country, but you have to work with the NGO and with the government and with the private, and you have to do the priority setting and advocate for things that matter and translate it to policies that improve the health practices in your country. NGOs always, as I mentioned, they partner with the governments while maintaining the independence from the government. What is patient empowerment now and why we care about patient empowerment? So the World Health Organization defines empowerment as a process through which people gain greater control over decisions and they take care of themselves and they take care of their health. They are in charge. When you empower someone, he's responsible. And we really need this mindset. When I empower someone, I give him the responsibility. He will take care of himself and he will help me to achieve better health. So this is the idea of the patient empowerment. So the empowered patient, he is part of the decision making. If you look at the old style, when we are talking about hospitals that are patient centric, it used to be a good word to say patient centric. So he's in the middle and everyone providing the service to that guy. However, now it's not the case. He's not patient-centric. He is part of the healthcare providers. He's part of the team. He's a decision maker as them. So this is the empowerment we are talking about. It's not unidirectional way. Everyone has to involve the patient and take his opinion and discuss the options with him. He has the right to take a second opinion. So he's part of the team. He's not coming passive and getting treated and released from the hospital or discharged. He is part of the decision-making process. And this is when we are talking about empowering our patients. The patient empowerment, again, it should be high priority for healthcare policymakers in many countries, and this is happening. And also patient empowerments lead to less medical errors and cost-effective care. Since we are talking about patient safety, I will mention to you a story with Emmy. So we always think about patients as the last barrier. So when you come to the hospital as a patient, hospital is 70% human, and human make mistakes. To err is human. So you are coming with in a place where it's 70% human, they make mistakes. So why you are passive and coming in without checking, without reading, without questioning things or asking, and it's your right. So what happened with Emmy, she shared her story with one of the European NGOs. Basically, she has a new glucose monitor and she used it and she noticed, well, the readings is not right. So she started to note these readings. Then she met with the nurses and with the physicians, indicating that, well, those numbers are not accurate. And it turned out to be, she's right, it's not accurate. And it turned out to be the new brand of monitors defected. It has a problem. So the take-home message is, when you come to the hospital, don't be passive. I know they don't have bad intention for you. They all have good intention, but they make mistakes. So you have to be in charge of your health. You have to be responsible. You have to do your homework, and you have to be empowered where you are reading all the information, understanding everything, asking the right questions, writing everything that's needed, and that's where you are empowered. So what is empowered patient again? Individuals who are equipped with the knowledge, with the tools, with the responsibility they carry. They are enabled. they have to be enabled, because if you educate someone and equip them, but they go to healthcare system, doesn't listen to them, they are not enabled, and they have to be engaged, and they have to communicate with the healthcare providers to reach the best health decisions. We always believe empowered patients, they make the right decisions. We need to get them involved in everything and let them make the decisions with us. I will share with you now our KSA experience, Saudi Arabia experience, and it's the NGO. Rufaida, it's the first women's health organization NGO in Saudi Arabia. Again, the need to have such an NGO in Saudi, it was obvious for 4 different reasons. The first one, we lack reliable Arabic language information on women's health. In order for you to educate your community, you have to speak their language. Not all of them speak English, and we need to provide them with the accurate and reliable health information. So that was the first reason. The second reason, the low level of awareness surrounding women's health, either with public or even healthcare providers, because unfortunately, no one sees the women's health as a holistic view. They always think about it as a gynecological health only, and women's health is beyond this. And the most important one is the women's health rights and laws. That's our talk today. So we need to protect women in the healthcare system. And these are the reasons why we decided to start Women's Health Organization. That's a civil society organization to serve the women in our community and to be the voice of women in our community. Here is our core strategy in Rufaida. We educate, we train, and we advocate. And here you can see lists of programs under each core strategy. We have the birth plan, we have Unfiltered Talk, where we discuss things very sensitive. You are entitled, this is the women's health rights. Puberty for young girls, just to educate them about the puberty and the period of her life. Total control as well. This is pelvic health. This is Kegel exercise. Also sexual health workshops. Advocacy is another strength of Rufaida, where we find things that need to be improved in the healthcare system and that needs to be advocated for. We have a yearly forum where we get together with the policymakers to advocate for women's health rights. And for anyone interested, we will share with you the link and you can see our events, and you are more than welcome to use any of these programs. We are willing to share it, maybe through the Saudi Patient Safety Center. Feel free to reach out and it's all yours. Here is our collaboration with Houston Methodist as well. We provide webinars for healthcare providers that's accredited by the Saudi Health Commission. Here are some parts of the training that we do. And here is the workshop also on sexual health that we have offered to women in Saudi. And here is the birth plan that we created through our website, where women can create her own birth plan, and she will print it and she will go to the physician to ask for what she prefers during her pregnancy and birth journey. We believe it's a journey and it has to be enjoyable. She's not diseased person. So we really focus on health rather than diseases. Actually, we won with this birth plan project, the Saudi Patient Safety Center Award. That was 2019. And again, as I mentioned, we are working together to improve women's health nationwide. Now I would like to share with you some of the challenges and lessons learned, and I believe low and middle income countries, they share the same, and they have it, as the burden of diseases is high in the low and middle income countries. As infectious disease expert, I always believe that infectious disease does not respect borders. If I have an infection somewhere, we are not safe anywhere. So really, we are working together when it comes to disease prevention. In some countries, NGOs are not empowered. And again, you are losing part of your community because some of the NGOs are not empowered. Just imagine you get everyone on board and it will be a strong movement and we will reach the SDGs faster. Healthcare provider resistance. This is one of the challenges where the healthcare providers, they don't like to work with empowered patients because they think they are headache. I want someone passive, someone quiet. I just give him the treatment and he leaves. And this is something that we need to work on. Patient resistance and the opposite is something else. Patients, they don't want to do their homework. They don't want to be responsible. They want to blame someone else. So again, we have to balance this out and we have to be creative and we have to speak the same language as our community just to lift them up. Social. Again, we have conservative countries, we have social boundaries, we have things that we need to consider. Religious as well. Sometimes there are certain set of things, especially when it comes to women's health. It's not easy to discuss in any nation. Political, it could be one of the challenges, and literacy. Literacy. It's very important. Education and knowledge is power. If you have knowledgeable people, they will seek the good health and they will take care of themselves. So now we need to change the culture. Empowering patients seen as a threat by some professionals, as I mentioned. So we have to view patients not as users and choosers, but as makers and shapers. So they are stakeholders. Whenever you are sitting and deciding something, he has to sit with you on the same table to decide because he's a maker. Balance of power needs to change. Professional needs to accept patient empowerment, and this has to be institutional, not up to individuals. Recognize patients as experts in their care. And believe it or not, sometimes you see patients who are very knowledgeable because they only have this disease. They have read everything about this disease. We just need to direct them to the accurate resources, accurate information, and they will help you throughout this process. Focus on education, training, communication for professional. I think it's very important. These webinars is very important to all of us. We have to be up to date and we have to empower others as well. Changing the culture, Google syndrome. So most of them, they look it up and they come already, they have the diagnosis. So don't stop them, just teach them. We have the responsibility to provide the accurate information in our own languages. So we need to direct them to the right resources to use Google accurately. Now we have misinformation and we have disinformation. And we have seen this clearly during COVID with the anti-vax movement. They are getting stronger and stronger. And this is, as a healthcare providers, this is our responsibility to stand strong and to provide the accurate information to our community and not leaving them to this such a misinformation or disinformation. We are all part of a community and we will become either us or a loved ones, a patient one day. So we have to be advocate for everyone.
دكتورة فاطمة عذرا 2 minutes.
Yes. I'm done actually. Actually, I'm done. So you cannot empower a patient if the system is not functioning optimally. What does that mean? You cannot empower a patient and the system is not right. I don't empower patient to go get vaccinated for HPV. And when she goes to the hospital, it's not available. Or I don't empower patient to follow the birth plan. And I ask her to print it from the website. And when she goes to the hospital, they said, well, we don't care about your preferred way of having a baby because we don't believe in a birth plan, for example. So again, whenever we are empowering patient, we have to be sure the system, the healthcare system is optimal and will accommodate our empowerment process. With that, I will end my talk. So our health is our wealth. So we need to invest in that. Thank you.
Thank you so much, Dr. Fatma. Thank you. It was a great presentation. Our next speaker, sorry for not taking questions now, due to lack of our time. We'll try to make our questions at the end of the session. And please, keep tuned with us. Our next speaker will be Dr. Nada Munshi. Basically, Dr. Nada Munshi is presenting to us on behalf of Dr. Abdullah Asiri, our Deputy Minister for infection prevention. However, he had an emergency. So Dr. Nada will be presenting on his behalf. Dr. Nada Menshi is the director of the Department of Prevention of Cervical Cancer and Human Papilloma Virus, the assistant
Sorry,
deputy
Doctor.
chief.
Dr. Mansour will start first.
Okay,
I'm with
so
you.
Dr. Mansour with us.
And Dr. Nada.
Yes, I'm here. Yeah.
So who will be starting now?
It's okay either.
Okay, so can we go? Dr. Mansour, you would like to start now or after?
Yeah, I
Dr.
can
Nada?
start. Yeah, if you put just, I have one slide to show my
Yeah, sure.
points.
Okay,
So
so
it's gonna be short. Yeah.
Sure. Our next presenter actually will be Dr. Mansour Al-Hajla. Dr. Mansour Al-Hajla is a distinguished expert in health law, currently leads a law firm as a managing partner. His illustrations career includes roles such as the Vice President of the Healthcare Transformation Plan for Legislation and Legal Affairs and Secretary General for various health ministerial committees in Saudi Arabia, renowned for spearheading legal framework in the health sector and his contribution significantly to the transformative projects.
Yes, I would like to start about my journey with health law. My background is Islamic law and my bachelor degree. Then I got my master in judiciary. Then I went to United States, studying also master and PhD, focusing on health law. Then I came back to Saudi Arabia in 2016. I started with the transformation program in Saudi Arabia with very ambitious program to reform health sector. And I lead all of the legal initiatives related to health reforms. I would like to speak about we as a legal specialized legal or as a lawyer in that field. I would like to focus on the content of health. We have to understand the mechanism of health before we proposing any bill or any laws to the government. So I spent quite of time with the Ministry of Health and the several programs to understand our direction. As Dr. Fatma mentioned, some concepts, very important concepts. We started with to make our direction, to do a shift in our health sector, as Dr. Fatma mentions, from disease to health, from Ministry of Disease focusing on disease to Ministry of Health focusing also to community, to preventive care, to prevent, to have focusing on the people, on the community. So the second one is shifting from funding according to the bed rate to focus on the patient. And the biggest reform in that regard is making separation between regulator and provider and payer. So Saudi Arabia started 2 years ago to make that separation. We are in our way to complete that separation between provider and regulator. Ministry of Health used to be 3 in 1 as regulator and provider and also payer at the same time by receiving the budget from the government or Ministry of Finance. So the reason of that separation is to raise the efficiency in the system, to have accountable system where you can ask the provider and you can also measure their outcome. So That reform was very important to us, and we think it's gonna achieve our goals. We have strategic objectives. We're focusing on we're focusing on the triple aims, which is accessible, quality, and also affordability. So these the three strategic objectives we focused on in our reform. So we are going to that direction. I lead a project called Health Law Project. We focus on the objectives. We focused on the concept of quality, where the quality has the three dimensions: safety, effectiveness, and patient experience. So as Dr. Fatma mentioned about engaging patient, not only as patient-centric, also as a part of the process of treatment. For example, if you go to the concept of informed consent as a legal concept, you will find the history. If you read any book, when I studied in the United States, I found a big book about informed consent, and I read that in the beginning in the United States, they were like us in the past. The doctor, you can't ask the doctor about your situation. The doctor just gave you his direction, just one direction. He can't make any dialogue with you. If you ask him, he will kick you out from the room, as in some countries. So that it was in the United States, not only in the poor country, or it was there. Even we had experience in the past. The doctor has a lot of respect from people to get his help. That's why there is no concept of informed consent. Later, with the history, you can find the awareness of human right. Then a lot of laws changed to respect the patient's consent by regulate informed consent. And the doctor can tell the patient about his problem with the options, possibilities, and alternatives. So all of that came with over the time, not in one shot. So in Saudi Arabia also, according to as a part of that world, we learned a lot from a lot of experience from other countries, and we are trying to apply good concept with our Saudi context. We have great context in Saudi Arabia. We are family-oriented people. We are helping each other, and that's the good thing. Also, our country is focusing on social sector, providing healthcare for people, not only providing accessibility, but also providing direct healthcare to our people. And we also propose new laws to reform the old laws to improve our services, because we were in the past, we think that if we build a lot of hospital, we will fix the problem of health, but we found that is wrong direction. It's not about building hospitals, or it's about the way how to tackle the issue of health in your community, and you build strong relationship between health providers and the community. So this is, we have a lot of initiatives related to that, corporatizing governmental health facilities in Saudi Arabia. Through these facilities, we provide a lot of programs related to model of care, screening, breast cancer, for example, and a lot of diseases in public health. We have a great story about reducing huge amount of percentage in communicable diseases. As a country has good income, we have problem with lifestyle. Non-communicable diseases still challenges to us. We have a lot of programs related to preventive care with sport, like these community programs, and also smoking problems and other problems. We have these problems in our country. I think these problems are big challenges to us. With creating accountable care organizations in our system to have value-based system, we can reduce the amount of non-communicable diseases. Go ahead, Dr. Ahmed. I think I don't want to take a lot of time more than that.
Thank you so much, Dr. Mansour. It's really informative. And as you mentioned, the healthcare transformation program is basically changing the whole practice that has been for tens of years and becoming basically separating the three sectors from the healthcare providers to the healthcare payers and finally to the regulators, and moving from disease into wellness and preventive part, with stakeholders being every society, every government, every ministry, and every association, including everyone in. We'll be taking basically all the questions at the end so that we can have like an excellent time with our speakers. And our next speaker is Dr. Nada Munshi. Basically, she's the director of the Department of Prevention of Cervical Cancer and Human Papillomavirus, the Assistant Deputyship for Preventive Health, the Public Health Deputyship, Saudi Arabia Ministry of Health, leader of a task force program to vaccinate girls against HPV. It was the first time in Saudi Arabia to have a national program, school-based, through Ministry of Health with collaboration with the Ministry of Education. And it was basically started in 2022, involving girls from the age of 9 to 18 years, and just recently moved to include even up to 26 years of age, and also involving primary health cares as well. Dr. Nada, go ahead, please.
Yes, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you so much for the introduction, Dr. Ahmed. And now I will share my screen to start the presentation. Okay, so as the bio said, and then the objective is to highlight the governance effort to support women's health policies and women's health rights. So as we all know, to protect women, it starts from their early years, and that's when it comes, we talk about the vaccination role and maintaining a good health for females in general. So this is why we were so focused to start this task force that I led in 2022 to start an HPV vaccination program. It was school-based. So this is the steps. I'm really going to go through very quickly because I want to focus on other women health services that we provide in the MOH, Ministry of Health. So we had the whole plan. It has cohorts and demographics. We have endorsement. This is I'm going to talk about more because we have a governmental role in the success of the whole plan. And then healthcare professionals, education and ownership, media training, journalist academy, patient awareness, communication training for frequently asked questions, vaccine hesitancy, proactive and reactive, social media readiness, and adherence and tracking and timeline of the program that you're going to see in a figure at the end. So before starting, the HPV vaccination, when we give a girl or a female that vaccine, we are eliminating cervical cancer. So it's a bigger vision than only controlling an STI or STD. And then when we start this program, we're changing the narrative, and our government made sure that the world considered Saudi Arabia, Kingdom Saudi Arabia, as a pioneer country to have such initiative implemented in the whole Middle East and North Africa region. Okay, so the endorsement, this is the most important slide. It might help in implementing other services for women's health, but we're going to talk now about the HPV. So what happened is I started and led a task force through Ministry of Health and the Assistant Deputyship for Preventive Health, led by His Excellency Dr. Abdullah Asiri, the Assistant Deputy Minister for Preventive Health, to include the vaccination in the National Immunization Program. And thank God we succeeded to do that in March of 2022, and still going till today. And it will continue for next years as well. So we had the support of governmental entities, not only that we have collaboration of the Ministry of Education and Ministry of Health, we have other VIP personnel in the government endorse this important vaccination. And then we have other support from other external societies, and we call it external task force, like the Saudi FDA, King Faisal Special Hospital and Research Center, and NGOs like Rufaida Society. It's a pleasure to meet even Dr. Fatma Al-Hamlan. She leads that society, and Her Highness Princess Modi, House of Saud. So we were with us from the beginning. We had even meetings pre-implementation, and that was of a good and of a beneficial start of the program. And then we have to unify the message and the communication of the message, and it has to be always from MOH or MOE, Ministry of Education, social media platforms. We really limit the people talk about it from other entities, so people can take the right message from its right source. And here you can see we have a lot of education for healthcare practitioners or personnel, and school health personnel through the Ministry of Education. So it was a collaboration. And then the media training, it's so important to always broadcast the right message. So we went really away from broadcasting a message that we are eliminating or controlling STDs, sexual transmitted diseases. We have always to say it's to eliminate cervical cancer. So you always have to pick up the correct line. And as you see the hashtag, protect their future. So it's for the sake of their future. And then, as we said, patient and parents awareness, we had whole presentation and flyers and booklets that will distributed through Ministry of Education and the schools for the girls. So the cohort was 7th grade or the first year of junior high school. So we really targeted a target group. And then we had a whole line, which is, it's already been established, was called Health or called Saha 937, but we had a whole unit that can answer questions about HPV and cervical cancer. And through our social media MOH platforms as well, we have inquiries answered immediately. Okay, so we had plan, as we said, proactive and reactive, social media readiness. So as we said, we always have to make sure the anti-vax groups, those anti-vax groups don't succeed in their cause. So this is what we do. We had an agency, external agency that monitor any negative or anti-vax comments that might lead the people to really be hesitant about the vaccine. Adherence and tracking, we had a whole system in VR that registered all girls and their doses been taken. And then, thank God, and later on 2022, we added another cohort, which is 9 to 18 years old, through a model of care, which is called Physician for Each Family, through the primary healthcare centers. And the practitioner will tell the family, oh, we have this new vaccine that we can give your girl from 9 to 18 years old. Do you want to give it to your girl? Not only her parents. 18 years old or 17 years old girl can go and ask for an appointment to get the vaccine herself. And thank God we made it even of a larger target group in 2023. Girls from 9 to 26 years old can get it as well, optionally through our primary healthcare centers. Okay, so this is the whole timeline. It's really beneficial to notice how we went through the process. And then I have to mention that because the vision of 2030 of our beloved country, Kingdom Saudi Arabia, helped us a lot to maintain this amazing program to eliminate cervical cancer eventually. And nowadays, we are so proud to announce that we have a coverage rate of between 70 to 80%. And really, let's celebrate this moment all. And this time, I want to talk about other services that been provided by Ministry of Health for Women. So you see, I give you HPV program because we started in a very young age. But if we want to talk about the woman in her whole life, we have amazing program led by amazing colleagues that I have in the Ministry of Health. So we have the national programming campaigns to raise awareness of the importance of early detection of breast cancer. We do mammograms. We have centers in the malls. We have mobile units that go and do breast cancer checkups and mammogram for older age groups. And then we have programs like Protect Yourself from Osteoporosis for the target group of a range of age, and then postpartum pain care program, and then a program for sickle cell anemia and pregnancy. And then we have a whole family planning program for the girl pre-even marital. Maybe I didn't put this in the points, which is we have a pre-marital program that educate both partners or fiancés who are going to get married soon to have all the necessary psychological and other social, skills to maintain a healthy marriage. And then we have STD control programs. And then we have the health passport for mothers. We really monitor the mother. It's a pre, during, and postpartum. It's an amazing program and passport. And then we have many programs for pregnant women, not only about only their health. We take care and talk about their occupational health and their job. And then what are the allowed meds that they can take? What is the right status of a woman, pregnant woman, to be travel and how far, and then allowed sports and physical activities and nutrition of pregnant women. And then we have a program for encouraging breastfeeding, of course. We are with it, and we have amazing programs through Ministry of Health and other actually healthcare entities and hospitals, private and governmental, to encourage breastfeeding to women in general. And then we have the program about high blood pressure during pregnancy, pre-eclampsia, and the program about educating about home exercises to tighten the abdominal muscles. So you see, we take care of them even postpartum. So it's not about only health. We encourage them to do exercises to maintain a better shape and better health, because that will help them in their marriage and to really have a good self-esteem. We take care about psychological aspect as well. And then we have a program for trichomoniasis. And then I want to really, before the question and answer, this is my account for any collaboration and inquiries. I do really a free consultation for the whole public. And this is an amazing code that I took from the Middle East and North Africa Coalition for HPV Elimination. This is something I said, and it really helped us. Before implementing any vaccination program, prioritizing communication media readiness is essential across all countries. In Saudi Arabia, leveraging the lessons from the COVID-19 experience, we focused on enhancing public awareness about the HPV vaccine. We're pleased to announce, and then I announced the coverage rate, and then I was very proud that my country is a pioneer in that area, and we can implement this message in any women health services that we can implement in any of the countries. And thank you so much.
Thank you so much, Dr. Nada. We'll be taking now questions from the audience, and the move on, honestly, from sickness detection of diseases and screening into enhancing and empowering wellness, which is basically for the whole community. And as you just mentioned about two issues here, number one is basically a physician for every family. So our wellness actually program is outside healthcare professionals areas, outside primary care centers and outside hospitals, because basically more than 90% of the community are well and healthy. How can we maintain their health, whether they are actually families, men, women, and so on? And that's why the approach now is becoming wider. This year, 2024, will be the wellness year with different campaigns and different stakeholders going on. We'll be taking actually questions now, and I'll be starting by those who raised actually their hands. Take first a question from Shadia Rahim Niaz. Yes, please. Ms. Shadia. Okay, we'll take the next question by Sylvie Abastian. Sylvie Abastian. I'll actually take one. Well, I just took one case. Actually, it was written. Dr. Fatma, question for you, please. Dr. Fatma Al-Hamlan, are you? Can you hear me?
Yes, I do.
Yes, please. You mentioned about the NGOs, which is really very important, and the enhancement and empowerment of NGOs. Do you think actually we are now more mature about the role of NGOs? Are these NGOs now are really mature socially, and they know exactly their role in changing community issues such as health and wellness, or do you think we are still in the process of getting more mature, or let's say we're getting more aware and more ready? How do you really explore our situation regarding NGOs?
Well, if you look at NGOs in Saudi Arabia in particular, we are growing, but we are not mature yet, at least from my point of view. I think when you say mature NGO, that's a standing strong NGO, that's financially independent, that has the freedom to invest and to generate a revenue and maintain the financial independence. And we are now moving toward this, but still it's not common practice. I would give it 2 years, 3 years while the regulation taking place, because as you know, we moved from ministry to a center, which is for the not-for-profit center. So as things are moving still, I think it's not maturing yet. I would love to see it more maturing. Also, from people perspective, it's been, whenever you are talking about NGO, people, they think it's a charity. So you are given money.
Right.
Or you are giving services for free. That does not
Right.
make sense, because you are an NGO, you need to charge. However, you might find a sponsor to cover these charges, but you need to generate revenue to hire staff. You cannot provide the best quality for free. And people think, no, you are an NGO, you have to be free. And this is, again, the mindset of people. However, if you look at the NGO, it's exactly run as a business. However, at the end, we don't divide up the shares and take it. It comes back to the operation and the expansion. So this is, I think, here we are still struggling with this part, but we are moving forward. I should say this.
Great to hear that. Well, it's still at least actually we are in the process, which is nice to hear, because it's not just like, as you mentioned, about numbers. It's basically about the efficacy of these NGOs, and they're really part in the healthcare and in the change and in the social part. We'll take now actually questions from our audience. I'll go back to Mr. Selby. Dr. Saqib. Abir Ma'moon. Okay, if you cannot actually, if your mic does not work, kindly actually write to us your question as a message, and we will answer the questions if there is any technical issue, so that we can utilize the time. And my question now is to Dr. Mansour. Dr. Mansour, you really mentioned about a very, very important issue regarding what has been done so far since 2016, which is basically the backbone of any transformation, and that is basically changing many laws and introducing laws and probably eliminating laws and so on. Can you actually tell us basically what were actually the major challenges that faced us in order to change the healthcare from what is happening now into the like the transformation to what happened so far, and in collaboration with the 2030?
Yes, I can mention some challenges in general that to fix these challenges. One of the aspects is to fix legal or legislative aspect. For example, the concept of focusing on inputs, not outcome. Which is, for example, we have in our current health law focusing on safety only. You can find in, I forgot the article, maybe Article 8 or 9, mention a lot of word like salamat, safety of water, safety of food, safety of public health. All of these concepts just focusing on in one aspect of quality, where we are heading to cover all of the 3 dimensions of quality, which is effectiveness, safety, and also user experience. This is the concept of quality. So, and also we fixed a lot of individual issues related to liability. Our old law or current law until now, we're gonna fix it. We have our new project in Council of Ministers. Maybe in 1 or 2 years, it's gonna be effective. It will be in place related to the liability of healthcare organizations, not only on the healthcare professionals, where the liability will be shared with them. So what we call it in law, vicarious liability. So that will raise the quality of services, because medical malpractice is not only on the practitioners. It's about the system around the practitioners. So when we fix that law, it will help to raise the quality of services for our people.
Great, great. As you mentioned, part of the transformation happening now is that the health holding company, which is basically governmental owned, moving the provider, especially those who are not actually aware of Saudi Arabia, a transformation process, which is the health holding becoming a company that really provides the services into 20 clusters. Each cluster is working as a module by itself, incorporating primary, secondary, and tertiary care, serving a population of almost 1 to 1.2 million population. They will be actually the main provider of the service as an operator. And then again, there'll be the National Center for Health Insurance, which is the one that pays for the service. And finally, the Minister of Health will be regressing to be a regulator and a monitor. And by this, really you are decreasing or even eliminating the conflict of interest. That's why every part will be doing its part in a perfect way, and will give us definitely at the end a better module and better outcome and a service. And again, focusing, as you said, on the environmental aspects and safety of issues all around us. We can see that by the efforts of the Ministry of Environment, by the Ministry of Sports, by the education transformation. Everything around us is working in an orchestra in order to reach into the Vision 2030, which is really visible to everyone. Dr. Nada, basically, you mentioned about HPV, which is a great job, and definitely it's a step towards monitoring other illnesses and other problems. And the other thing actually is, what about actually our similar campaigns in regard to STIs? Like, for example, you mentioned something very important that we are screening for like STIs during pregnancy, which basically is preventing vertical transmission and catching these cases on time, providing help and service and counseling for the mother, the family, and the future babies. Can you just give us a quick say about this?
Absolutely, absolutely. So the STI program or control, I actually was working in the unit. We had amazing screening through rapid tests, for example. Some of the tests we had for them, like chlamydia or gonorrhea, syphilis, and we do counseling if we have a woman or in our OBGYN or dermatology, and men in neurology or dermatology. We actually counsel them and we provide them with the right medication for them and the partner, and we ask them that if we can counsel do counseling for the partner as well. And then we have the statistics of the whole country. So all region of Saudi Arabia, we have a Department of Health in each region that they report to us. So always we have a good eye on the statistics of the STDs and how we can control, for example, in a region that have increased and some of the STI more than the other. So what preventive measures that we can provide so we can decrease that rate.
Excellent. As we all know, like the Saudi Center for Patient Safety really been incorporated in many programs, in many national programs, and honestly, as mentioned by Dr. Fatma, part of what happened is like related to like the birth plan, which is like maternal empowerment. The other thing is the informed consent. Informed consent is really also done with the collaboration of the patient safety as well as the ESR and the safety, the essential safety requirements, which is like really something widespread everywhere to all health providers, including like private, including governmental, as well as not-for-profit providers. So the role of the patient safety becoming more and more, and now there is like a national strategy for patient safety being actually worked on, which will be actually coming soon, as well as there are in the pipeline things related to maternal and perinatal safety programs as well. So this is, again, that will be really focusing on the effect of prevention, on the importance of prevention, as Dr. Mansour mentioned, that we're struggling with like chronic diseases, struggling with things like non-communicable chronic diseases in order to work early and to intervene before they become like more strong and more difficult to manage and so on. The other thing mentioned by Dr. Fatma, which I'll go back to her, please, is that she mentioned about the empowerment. She mentioned about the involvement of the patient in the management. Our society still is not really aware of the so-called informed decision. My job as a practitioner is not to decide on your behalf. It is not to just push you for one option or the other. That's why, changing the atmosphere, the culture by like allowing more options to the stakeholder or to the customer and being more involved in their treatment. I think it's an art. I think it's a culture, and many empowering elements are important there. And that's why, working on this issue with the media, with the multimedia channels, using the media in a very positive way, as they mentioned, like Google is fine. However, we need actually to put a trusted kind of platforms where we can communicate easily and access, and where we can actually reach into what is really of benefit, rather than just depending on recommendations from here and there. We say in order to change a habit, I think there is in Arabic the al-mimat al-arba'a. The first meme is basically starting from al-manzil. The second meme is al-madrasa. Third meme is al-masjid. Fourth meme is al-media. So altogether, I don't think actually we can change. We can move into real wellness or comprehensive wellness without involving the whole four together in a comprehensive orchestra, or let's say symphony and a melody. Before we end up, if there is any question that we can answer, if there is anything from our guests, our speakers, they would like to put an input about our session and our panel, and I will start with Dr. Fatma and I will move on.
Thank you, Dr. Ahmed. Thank you for all speakers and attendees. I don't have anything to add. We are here to answer any questions you have.
You're welcome. Dr. Nada?
Thank you so much for having me to present about this important topic. And we look forward to really establish even more women health, preventive health care for the public. And thank you so much. If anyone has a question or nothing further to add.
Okay, just before I move to Dr. Mansour, one question is How about actually we move on? I know actually that we are saying that one doctor or a physician for a family, which is very important, to see, as well as that we're having like the Well Baby Clinic. We are really looking forward for a Well Woman Clinic as well, because I think a Well Woman Clinic is just beyond pregnancy and antenatal and so on, and it's really very comprehensive, which is really of great value, I guess. Dr. Fahad? Sorry, Dr. Mansour.
Yes, I would like to thank WHO and also our colleagues in Patient Safety Center. Hiba did well with us for preparing this webinar. Thank you, Dr. Ahmad, for your managing this webinar. Thank you, Dr. Fatma and Dr. Nadia.
Thank you so much, everyone, and we hope actually you had a great time with us. Please, actually, you can watch us or share it with your colleagues, and it will be announced in the website and in the accounts of the Saudi Patient Center. Seeing you next time with the next and more activities. Thank you so much, and have a blessed evening.